I see you more than.
So good afternoon. It's my pleasure to be here. Thank you, Samir, for inviting us to be part of this great gathering. Our focus this afternoon will be on healthcare. And as we know, providing quality health is an investment in the socio-economic well-being and a key contributor to the wealth and economic productivity of a country. So when we look at healthcare innovation, it saves lives, it saves money, it promotes economic growth, and provides hope for hundreds of millions of people, both patients and caregivers, both in the United States and around the world. However, there are many roadblocks beyond those of discovery and development. So it's not about discovering these innovations. The complicated and conflicting dynamics of politics, perspectives on healthcare economics, the friction between providers, payers, manufacturers, regulators, the battle for better patient information and education, and the need for a more forceful and factual debate over the value of innovation. So what's the value of this innovation and the billions of dollars that's being spent on? All that create the need for a more balanced and robust debate. So I'm glad now that we have, from the whole spectrum of the healthcare, our panelists. Maybe we'll start with Dr. Tony Farah from Allegheny Health Network. Dr. Farah was telling me they are the third network providers in the United States, so welcome. Our second panelist is Dan, and Dan is the Senior Commercial Director for a huge company. You see the name everywhere when it comes to innovation services and other, Thermo Scientific. Our third panelist is Jeff Cambricus from Merck & Company, one of the big leading innovative biopharmaceutical companies, has been around for so many years and brought a lot of discoveries. And our fourth panelist is Marwan Abdulaziz, and I don't want to introduce Marwan because he introduced himself and he has been giving. So maybe to start, I will start with Dr. Farah and ask him, we know that healthcare cost is escalating everywhere. If you go from the United States to Korea to Saudi Arabia to everywhere, everybody's complaining about the healthcare cost and it's escalating. So why do we find ourselves in that environment and this environment continue to escalate?
Thank you. Hope everyone can hear me. I can tell you here in the United States, one of the main reasons for the escalating and really unsustainable healthcare costs is the fee-for-service environment. In other words, the more a physician or hospital delivers care, the more they make. And as most of us know, the government is now under quite a bit of pressure to transition that fee-for-service environment to what we call value. And what we're trying to do here in our region is, I come from an environment where we have 7 hospitals, about 2,200 physicians, and a large payer, Highmark, which is based here in Pittsburgh. It's a large insurance company. And it's a pretty significant opportunity for us to look at global healthcare as opposed to just the current environment we're in, which is very much siloed, where physicians do their thing, hospitals, insurance companies. And so as a result, we now have this integrated delivery network, which really gives us an opportunity to do a number of things. So from a patient perspective, after all, it's all about patients. We want to do what's in the patient's best interest. And what do patients care about? They care about getting high-quality care, affordable care, accessible care, and appropriate care. The appropriateness of care is something not that many people have talked about historically, and that's a big reason behind the escalating healthcare costs. In other words, if I, as a patient, go to see a physician or go to the hospital, do I really need this blood test or x-ray or scan or even surgery? And I can tell you it doesn't take, we've modeled this, it doesn't take much deviation from standard care or evidence-based medicine to truly escalate healthcare costs. And as a result, what we're trying to do is we're pulling together providers, including many physicians, and saying to them, okay, if we as the healthcare community, the providers of healthcare, hold ourselves to a high degree of performance, and by performance I mean the value. In other words, we're going to provide this level of quality and outcomes. We're going to make sure it's affordable and accessible. And if we pay those physicians and hospitals based on that value, and the value is made up of those tenets that I just mentioned, then it really changes the focus away from more of a finance-driven environment, more to what patients really care about. And the end result, what you end up with is better outcomes. The patients obviously fare better. Right now, the government and the insurance companies are paying for unnecessary care, and by changing this model of payment, you end up with lower costs. That lower cost can then be shifted toward lower premiums, hopefully, right? It's a win-win-win situation. Back in the 70s and 80s, 80% of the healthcare premium dollar, was spent on inpatient care. In today's market, and it's no different here in Pittsburgh, it's only 18% is inpatient. So care is shifting rapidly toward the outpatient arena, and we can talk about a lot of examples of why that is and why that's better for patients. We're now performing outpatient hip replacements, outpatient neurological surgical procedures. There's a lot of things that are shifting toward the outpatient base as opposed to those more invasive surgical procedures. We're keeping care in the community. We don't really have to send patients, take them out of their communities and send them to those large academic medical centers for routine care. So we're sending our physicians out into the communities. There's a whole series of tactics that we're using to help reduce healthcare costs and at the same time improve quality. And at the same time, as you mentioned earlier, we're trying to be innovative. We don't really want to wait 10 years or so, we were talking earlier, before a drug that truly can save lives gets approved. And so we're partnering with CMU. I know there's folks from CMU in the audience. We're connecting the brain power of those CMU folks with our clinicians and coming up with ways that we can improve the current standard of care in a way that it just doesn't take 5 or 10 years to get from point A to point B.
Thank you. Thank you. So maybe we just move to Dan. I mean, Dan, your company is a giant company, has many branches, different brands in the whole healthcare innovation. If you can just give a brief description of what exactly the different aspects of the company, and before we ask some of the questions about the region. Yeah.
Okay. Yeah. So Thermo Fisher Scientific, we're a $17 billion company. We're a Fortune 200 company. We're providing. We're world leader in serving science, and we have a mission of healthier, cleaner, and safer. And our base of business is almost an equal split between healthcare, academic, pharma, biopharma, and industrial. And our operations are global. So that's a little bit about the business Thermo in general. We're basically providing products that go into labs for the most part, or different analyzers, online analyzers, other things like that. But providing analytical equipment as well as supplies that go into the laboratory environment.
Thank you. And I just talking to you before, you indicated that you are expanding your presence in the region, and you are moving to DuBiotech, to Marwan. So what's the plans and what's the incentives for doing that?
Yeah, so the incentive for doing that is, it's a couple things. One is, I'll address it in two parts. One is why we're expanding in the region, and then secondarily, why DuBiotech. But one is the growth that we have experienced in the region, and also the size of the market. By all estimates, we look at just the healthcare market by itself, and in the GCC region, we look at it, I think it's 15 billion plus just in new infrastructure and projects going in. So it's a rapidly expanding market. So there's that aspect, and plus we have grown in that market over the past 4 or 5 years. So that's one of the main reasons we're expanding there, and it's both local companies and governments that are expanding, but it's also our existing customer base. We see our existing customer base that is moving into the market, moving into the region, and they're looking for the same level of service and support, and that the places that they get in other parts of the world. So it's important that we're there in that region. As far as our immediate plans, we as Thermo Fisher Scientific, we have a couple of offices right now in Dubai. We just recently last year bought LifeTech, which is another a large life science company, and we're combining those two, and we're putting them into DuBiotech. Mm-hmm. And DuBiotech is going to be what we call kind of a center of excellence. So that's a pretty big deal for us, because the center of excellence, it's almost like a demo lab on steroids, mm-hmm. right? It's a training center. We have large pieces of instrument equipment. We bring people in there to train, to demo, and do other things from that perspective. So we plan on opening that in 2015 in DuBiotech. And it kind of fits in with our strategic plan. We want to be closer to our customers. We want to have more commercial resources. We want to have more technical support closer to our customers. So we're kind of using that as a hub for the GCC region, and then obviously all the benefits of being in DuBiotech, where a lot of our customers are, and just the proximity of flights and centralization into the region, and the ability to get to basically get there fairly quick and get to other parts in the region quickly. So that's the main emphasis.
Great. So just moving to an innovative biopharmaceutical company like Merck, and Merck has been in the region for so many years. And the first mission, Jeff, of the company is to ensure that you provide your innovative products to the patient in the region who need it. And so the focus is on healthcare. But increasingly, the countries in the region are more looking at, you mentioned actually in your question in the morning, that a lot of countries are looking in building biotech hubs and, right. and having investment in biotechnology. You could see it from the Bio Conference in San Diego this year. A lot of countries are coming there. Algeria is an example, Egypt next year, and all of this. So from your side, how can you balance between providing health, human health through your products, together with the industrial policy? So how you involve with the countries on industrial policy to help them shape the environment, but at the same time, create the environment that is conducive to that.
Yeah, well, Samir, I think you outlined kind of our primary mission, and all of us on the panel, mm-hmm. That it's to improve human health, to advance human health, and I think the companies have been active in that sphere for a long time in the Middle East, North Africa. Most of our companies are well established there. We've been providing our medicines, our vaccines. We've been doing a lot of education work for many, many years. I think what's shifted in the region is this new focus, new enthusiasm for the sector as a strategic sector within the economy. Now, I cover almost more than 80 countries actually in my region. So I'm Morocco out to Mongolia and Russia down to South Africa. So it's a huge area. But I would say today that there are about 10 or 15 countries that have started to signal to us over the last 4 or 5 years, yes, we appreciate your vaccines, we appreciate your medicines, we appreciate the contributions you're making to healthcare in our country, but we'd like to do more in your sector, in your space. Now that's required us to pivot a bit, to recalibrate as an industry, to start to have discussions about industrial policy in places where we haven't had them before. So, you know, South Africa is one of those countries where the companies are fairly well established, but South Africa, for instance, in January, produced something called a Bioeconomy 2030 report. This is a new strategy for South Africa. Morocco has declared us a strategic sector in the economy. Algeria has declared us a strategic sector in the economy. President Sisi in Egypt has talked about us as an important sector in the economy. Marwan is here representing the UAE. The UAE is probably the furthest out in terms of setting up the infrastructure, the framework, the legislation, the regulations that sustain and encourage the sector. Russia and Turkey are also contenders. This has required us to recalibrate, to think about what we're putting on the table in terms of guidance. You know, Merck, I should say that this is a sector that invests globally about $100 billion a year in R&D and capital improvements. That's a lot of money, $100 billion a year. Most of that money flows today to the global top 20 or 30 countries. So the United States is at the top of the list. But you know, the Germanys, the Japans, the established advanced economies. What I think you're seeing, and I think there's a huge opportunity here for the region, is that more of this money will shift over time to the emerging markets and to the countries in Middle East Africa, North Africa, that are working with us to promote the sector. That requires us to put some things on the table. So in other words, we've had to explore with those governments, you know, where are the strengths and weaknesses today? What are the current gaps? How would you get into the global top 30? How would you get into the global top 20? How do we benchmark? What are good benchmarks, for instance, for the UAE? Marwan, I think you mentioned Singapore earlier. It's an excellent benchmark. Singapore came out of nowhere 20 years ago. I think last year they got $3.5 billion in manufacturing and R&D investment out of the $100 billion pot. So that's clearly a tiger, a winner, and I think it's the kind of country that an on-the-go country like the UAE would look to. What are the lessons that can be drawn out of that? One of the challenges we face is who owns us? Who owns us in these countries? Right? Is it Dubai? Is it Dubai Biotech and Ministry of Health? Ministry of Industry? Ministry of Economy, Development? The Investment Agency? Everybody loves us, but how do you bring them together so you can create coherent policy? We've had experience, for instance, Saudi Arabia, where we're getting encouragement to invest there, but different ministries have different agendas and often are working at cross purposes. How do you get those ministries to understand the sector, to put forward policies that will encourage the sector? And it's a very competitive landscape out there. If you go to, you mentioned the Bio Conference, that's kind of the Davos of our sector. Samir, there are 50 or 60 countries at Bio, UAE was there, competing for that investment. And everybody's putting forward a different set of policies and incentives for the sector. So we have our homework. I mean, we've been commissioning studies, reports, pulling together the data to help advise countries on how they can become more competitive in the sector. It's been a shift for us, but I'm optimistic. A lot of countries are starting to say, hey, we want you guys to thrive in our country. Beyond the supplier role, we want you to be a strategic sector in our economy.
Thank you. So Marwan, you presented that what biotech, and you talked about it. I did not hear everything because I was just getting prepared. But when we talk about investment in biotechnology and attracting major companies in the whole spectrum, so Dubai Biotech, how can you play a role to increase the efficiency for For example, clinical trials. Still, the region is is lacking, major presence in clinical trials versus other regions, right, versus Asia, Europe. And so what role Dubai Biotech can do to ensure that the efficiencies of clinical research, which is clinical trials, is so important, because that's, that's part of.
You picked a good example. Clinical trials is such an, underrepresented sector in the region. And there was a very recent study showing that the MENA region only represents 2% of the global clinical trials that's happening. So 2% is really a very, very small number. And I think it's about not only about the industry. So the UAE has a very good presence of the industry. You mentioned many times that 80% of your members are based in Dubai, and that's really a testament of how Dubai has played a role of a hub for the region, with the connectivity, with the lifestyle, with the infrastructure. But that's not enough. That's only one pillar. I think the other important pillar is the regulators, and this is where it's sometimes a bit confusing, whether it is the Ministry of Health or is it who is it that really puts together regulations? Is it the local government? And the role that we play here is that we try to act as a neutral representative of the industry, and we sometimes go and lobby against new regulations that should come out, which will help the industry, and we always like to use examples. So we would say that Singapore, for example, or Turkey or other regions have these regulations, so you should pick and choose whatever works for you. But it's not easy, because again, it's about creating this ecosystem of industry, academia. Hospitals also play a very important role when it comes to clinical trials. Do we allow the doctors to conduct clinical trials, or are we telling them to go and see more patients? We need to also create that culture that doctors can work with companies and with CROs. So but I think what's important is to have a strategy, to have a plan, and to execute that. And we need to work, all of us, hand in hand, to realize that dream. Because at the end of the day, it is a relationship that we all are engaged with.
So Marwan, just to follow up on that. So, in your opinion, and watching the MENA region and the Gulf, first Dubai, the Gulf, and the MENA region, what are the challenges in the development of the healthcare industry there, and what are these challenges, and how can we overcome it?
I think there is a few challenges. One of the challenges is that, for example, the insurance scheme is very new. So in the UAE, for example, they just started with the local population, and in 2016 there will be a universal coverage of the population. In many other countries, the insurance is not very clear, and that's, I think, a very important component of the industry. Who are the payers here? Who looks after the population? Is it the government? Is it the private sector? So that's something, I think, which is evolving. We have seen the U.S. evolve now after, I think, 25 years. We're going from a fee-for-service to a value-based system. But I think what's important to realize is that we have tremendous issues of chronic diseases, and these are things that we shouldn't wait for insurance to solve, or we shouldn't wait for somebody to do it for us. And there are certain steps that could be taken to improve those things. So it's a very complex matter, and I think, like I said, everyone has a big role to play.
Thank you. Maybe coming back to Dr. Farah, I will go back to healthcare cost and the escalating healthcare cost, which is a major issue everywhere. And countries use different techniques in managing